A report out this year by the World Health Organization found that 1 in 6 people globally are affected by infertility. Now, we do live in a time where there are options to help couples who are struggling, but it's often a long wait to get into those clinics. It is time and labor intensive, it's expensive, and it's physically and emotionally challenging. That led one nurse to fill a gap that she saw to help couples navigate this arduous process.
When my husband and I became patients at the fertility clinic, along with being a nurse there, it really opened my eyes to just how much help is needed in the specialty.
Megan Kukic doesn't just talk the talk, she walks the walk. Working as an OR nurse at a local fertility center for 2 years and then needing those very same services. She and her husband have been on a 3.5-year journey of trying to start a family. They've done 6 medicated cycles, 4 IUIs, and recently egg retrieval for IVF.
I think there are, the celebrity stories that you hear, and they do go public once they've had success. So I think in terms of family and friends trying to be supportive, they think, oh, well, you're going to go through IVF and it's going to work because we've heard of all these other people that have gone through it. Unfortunately, that's not always the case.
But it's been something that I don't wish anybody to go through. It's not something that anybody that wants to have children and be able to bring children into the world, it's something that I didn't necessarily think about until the two of us kind of went through it together. So
Megan decided with her personal and professional experience, there was more she could do outside of the clinic to help these couples. In March of this year, she left her job to launch her own company, 412 Fertility Services. How would you describe your company?
I would describe my company as Pittsburgh's only injection administration and medication teaching for fertility patients.
These are just some of the supplies that Megan and other couples going through infertility need. Boxes of different medication and different dosages needing to be taken at different times. Megan says in IVF, up to 90 injections may be needed per one chance of having a baby.
You get a box of all of this stuff sent to your house, and then you essentially get sent a website that you can watch videos on how to do it, and that's it. That's all the training that there is.
Megan recalls her years of training to become a registered nurse and all of the supervised injections she was required to give as part of earning her degree.
To kind of think about, as a industry that we're allowing patients to kind of do this on their own just blows my mind.
With 412 Fertility, Megan travels to her clients' homes, teaches them how to properly dose their medication, and even offers to do the injections for them.
So you just take it off, and your medication is already in there. So you essentially would just get the air bubble out, and this one's ready to go.
And considering many of these have to be given at night, she's also filling an after-hours need.
It's not like you can call and say, hey, can I speak to, one of the nurses or whatever it is. So I'm happy to be a resource.
We're excited to see more people understanding, hey, there is help out there. There are people out there that can assist with these types of things, and you're not on your own. You're not by yourself.
In all of this, we didn't even touch on the financial hardship that infertility can cause. Forbes Health says the average cost of IVF in 2023 is between $12,000 and $14,000, and that doesn't even include the medication. That can cost anywhere from $3,000 to $6,000. Some states do have laws that require insurance companies to cover or offer to cover some of the infertility diagnosis and treatment, but Pennsylvania is not one of them. If you would like to learn more about Megan's services, her email and phone number are on her website, 412fertility.com. I'm Kelly Sasso, Pittsburgh's Action News 4.